rehabcovid19@gmail.com, and we're going to populate a listserv that'll come out by either Mike or myself. So now that that's out of the way, I'll pass it over to Mike, who you can kind of introduce yourself. Okay. All right, you should be able to.
Oh, there you go. Okay, yeah. Phil's got the controls there. I couldn't unmute myself. So. Yeah, thanks, Phil. Thanks, everybody, for being here. Just maybe emphasize a little bit what Phil just said. These events that we're hosting here are going to be every 48 hours or so, so they'll be every 2 days, and we'll get a better process in place and blast that out. And over the next day or two, we should have a functional website that's up and going to really be a host, a clearinghouse for this information. Phil, can you just get up those slides? I don't know, can I share from my place, or can you, does it have to be through you? Well, I think I can do it, actually. Okay, does that work? Can you see that, everybody? Give me a thumbs up, Phil, if you can see that. Yeah, okay. All right, so these are the documents that are going to represent the situation report. We often, the term is SITREP here. So these are the documents that we will be posting on Phil's website, and then we'll repopulate into the new one. But these will have standard issue kind of reports. So let's just go through some of the numbers. And again, I won't say this anymore, but I'll just reemphasize what I said the first time, is that we just have to be careful with these numbers, because each of the people, there is a person behind each one of them. And so let's not just think of big numbers, but think about the people behind them. You can see the global numbers there of confirmed cases, the number of deaths, and on a global level. Canada has a different, well, there you go, our numbers, 1,646. 24 deaths. I'll show you in a moment, those are a little different now. The Ontario Ministry has just announced an additional number of cases, 85 in fact, because of it. So anyway, there you go. Gives us a little bit of a cumulative view of the new case, the cumulative cases that are occurring in Canada. You can see the curve is quite dramatic. And just on a side note, the report from WHO has come out over the last day or two that looks at the number of days it took to get to 100,000 people infected, and that was in the 67 days it took for that first 100,000. It took about 15 days after to get to the next 100,000. You can probably see this, and it took about 4 days to reach 300,000. From a difference. So the curves, the epidemiological viewpoints in this are not, we remain on an upward trajectory in terms of global numbers. Here's our viewpoint in Canada. Higher provinces with higher populations certainly are demonstrating higher numbers. So that is BC and Ontario. And although we certainly will struggle with the larger provinces in terms of their infrastructure, just having a few new cases in some of the smaller places and even in the territories results in a real challenge for them too. So please don't look at these numbers as saying that some are just more heavily burdened. For sure, Ontario and BC have higher burdens, but also larger health systems in order to respond. So these are again just viewpoints. Let's have a look at this. This is a little bit of a rundown that we can see across the country. This is the most accurate. This is from yesterday. This is the Public Health Agency of Canada. The number here in Ontario is not 503. You have to add another 85 people, I think, to that number. So the numbers are increasing on a day-by-day basis. Just sort of viewed in a different perspective here, you can see some of the vectors of transmission, and we learned today that the vector of community transmission is as high as any of the other ones in terms of travel transmission. And so this has caused a fair bit of panic in among the public health agencies to try to understand how this is happening. And you will have also seen the ratcheting of new restrictions on travel and other pieces. I might end just here just by saying a new piece of evidence. Maybe I'll try to share it here. Another new piece of evidence is sort of just came out yesterday. Let's see here. Hopefully you can see that now. So those are the numbers in terms of our number of days to get to the 100, 200, and 300,000. So again, maybe to just reemphasize, it took 4 days for the globe to get an additional 100,000 people infected, or at least reported. I want to maybe kind of highlight this bottom one here. Is a new report that talks about how COVID-19 has an ability now to cross the blood-brain barrier and affect the olfactory nerves. This is, in a few different ways, likely to be a game changer from an immunological perspective. I'm not an immunologist, obviously, but when you dig into some of the data here, this changes. This means it can progress into the brain. And I know that researchers here at Duke University are already writing a grant to look at how that transmission actually has occurred. So the science, although is a little bit behind us in terms of figuring out the transmission and how the pathogenesis works, I'm so glad to see scientists around the world taking the challenge on and moving forward. So I think I'll end probably there. Here are the new cases. So what we have here in Ontario is 85 new cases. So this number right here is not 503, it's now 588. There were no additional deaths that were reported from my knowledge, but there were new cases, and these are community spreads, not travel ones. Some pretty impressive legislation that also is currently being discussed in Ottawa. Prime Minister brought forward a new approach that would release about $80 billion into the environment for a response, and I'm sure maybe many of you have been looking at this, but there is now somewhat of a distension. For this actually to pass, it has to be unanimous. And there's a few members of parliament who are dissenting. And so they're now in lockdown discussions to see if they can make this work. So on political activity in Canada, there's certainly some obviously in other parts of the world. We see an increased trajectory of numbers yet every day, where the epidemiologists are still looking for the tilt. Sadly, that doesn't seem to be anywhere close to today. And as I mentioned last time, most of the projection models identify North America as hitting a peak somewhere around next week, April 2nd. So Phil, I'll stop there. There may be questions later, but that's the situation report where we are today, what we know. I think it's great to pass it over to Jen, because what we're going to have to do now as a collective of physios is to think about how we respond. What can we do? While this transmission is happening, there are plenty of activities that are well within the scope of PT, and that's what we're going to talk about today. Phil, over to you. Thank you.
Yeah, thanks, Mike, for the situation report. So we'll do that every time where we're going to go through the sit rep to begin with. Now, one of the things that's really a hot topic in Canada with a lot of clinics closing across the country is Tele-Rehab and how to administer that. I know people that have done it and are in some cases having a little bit of difficulty actually working with patients. So we're really fortunate that Jen was able to join us today. She's, I'll let you introduce yourself, Jen, but she's doing a PhD basically in looking at how the use of Tele-Rehab in remote parts of the world and in Canada. So I'll pass it over to you, but thank you for being here.
Thanks, Phil.
And I can bring up those slides if you want. Whatever.
Okay, yeah, because I can't. I don't have access to them.
Yeah.
Just while Phil is doing that, I'll just maybe mention why we're doing this. You may have seen that there's been plenty of nastiness of people sort of breaking into other people's Zoom calls and creating some pretty nasty commentary and photos. So we're sort of sensitive to that. So that's why we've kind of shut down the other part. Over to you, Phil.
All right, so Thanks, Phil and Mike. So I guess thanks for having me today. So for those of you that don't know me, but I think most people do, I'm Jen O'Neill. I'm a physio in Ottawa. Mostly work in community care settings, home base with individuals with post-TBI and spinal cord injury. But my main duty right now is to finish this PhD, which is fully on Tele-Rehab and how to implement it with complex population who have balanced mobility and physical activity issues. So this is a hot topic right now, and I'm glad I can briefly talk about it today, mostly in the sense of the rapid implementation that we are currently seeing, and to help you think about a few points and maybe starvation and some self-reflection around the use of Tele-Rehab in this time. So I guess the first question we need to ask yourself or better understand is, what is Tele-Rehab? Tele-Rehab does encompasses a lot of different technology and different form of communications. But for today, and I believe for the current situation, we should refer to Tele-Rehab as a synchronous mode of communication, where we're using a platform, video conferencing platform, to engage with our clients or patients in a live but remote way. And what we're seeing currently with COVID is that lots of clinics, lots of healthcare centers and hospitals are rushing to implement a Tele-Rehab. This is good because obviously this is a great tool we have right now to use, but there's also some downfalls to it. So this is kind of what I want to discuss today. Phil, you can click to the next. Thanks. So the two main questions that we'll look at today is just how are we implementing it and how is it possible to implement it quickly? And the other one is why. Why should we use Tele-Rehab in this time? So a few points here to just kind of brainstorm about is, do we have the minimal knowledge required to implement this tool? So this is where therapists that didn't use Tele-Rehab before will probably run into issues right now trying to implement this too rapidly. So we strongly encourage you to get some knowledge and read some of the research and get some peer support, people that do have experience using Tele-Rehab pre-COVID, and they could help you implement this program or this service in your clinical area. The second thing to think of is the settings. So settings on the therapist end, but also settings on the client or patient ends. So what do you need to have in place for your session to be safe? So we're talking about going from as simple as a chair against the wall for the client on the other end, to the way you're dressing as a therapist for the client to be able to see you properly. So that's all pieces that needs to be put in place, and it's easily put in place, but we need to do this in order for Tele-Rehab to work properly. The third piece is looking at the logistics around Tele-Rehab. So consent form, adding Tele-Rehab to the consent form, every privacy and policy documents, looking at having an emergency and safety plan around Tele-Rehab ready to go, and the communication plan as well, if in case of strong delay, slow internet speed, or even the call dropping in the middle of a session where your client is standing up and not well balanced. So these are all of the logistical piece that needs to be put in place in order to safely but rapidly implement Tele-Rehab. The other piece, again, mitigation of risk and safety. This should be our first thing to think about. Yes, we need to use this resource right now because this is our only way to reach our client and our patients. But is it safer to actually reach them via Tele-Rehab, or is it safer to just provide an exercise program that they already know? So we kind of have to like juggle and really decide risks and benefits at this point, because none of our systems are going to be put in place perfectly. And the peer support I've already talked about. Feel like you can switch. So the next piece touches a little bit on what Phil and Mike were talking about 2 days ago. So why should we be using Tele-Rehab? And how can we leverage Tele-Rehab as a tool in this time as a resource for us to better care? So there's a few things we could think of. We could use Tele-Rehab to train the trainer kind of thing in remote education. So we all know that the need for cardio rest therapists will be high up there. And not all of us and not all therapists have been practicing in cardio rest or have competent skills right now. However, what we could do is use Tele-Rehab to have a competent therapist on one end and guide another therapist on the other side for some of the interventions. Another way would be to assist faster discharge. I think, Phil, you've talked about this 2 days ago, and how if we can kind of relieve the hospital system and discharge people a bit faster, we could use Tele-Rehab to do in-home check-ins, and even if people are not 100% ready to go home. And the emergency care is what we're seeing currently. I think a lot of people are using Tele-Rehab to provide their emergency care to their vulnerable current client, and this should be ongoing. The last piece, and I just want to kind of brainstorm and get your blood flowing here, your brain juice flowing, is the prevention. So we've talked about what to do right now during COVID and the crisis, but think about social isolation and social distancing. What does that, what will that look like in a few months? So I think we could definitely leverage Tele-Rehab as a tool to prevent and anticipate some of these issues and try to help with the immobility, social isolation, mental health, via exercises. So I hope I've given you a bit of food for thoughts, and yeah, if you have any questions, please put them in the chat box and send them our way.
Hey, Jen, can I kick it off here and just ask you, I just saw a tweet from CPA talking about an ability for PTs to bill for certain types of tele-rehab services. So question is, what do you think of that? And two, are there any amendments to this, or now can any PT just kind of go and do it? What do you think?
I think it's really by province at this point. I believe so. And I just saw recently that Sun Life, the CPA just posted that like 5 minutes ago. Sun Life they've reached an agreement where. So I think it's really provincial at this point and by insurance company. A lot of insurance in Ontario do cover Tele-Rehab, and I think in BC as well. There's still some gray zone in insurance policies right now. So yeah, but on the public side, it's all covered.
Okay, great. I just changed the settings, so you should be able to unmute yourself if you want to ask a question. All right. Any questions at all? I just saw a comment in the chat from Nancy that said she's been working in pre-pandemic and that she could share some good things and challenges. If there aren't any questions, Nancy, you can go ahead and unmute yourself and tell us what you're doing.
I've been working with a company. I've been working with a company, I guess, pre-pandemic for Northern BC. So there's been some communities up there that just haven't had any physio services for 18 months or more. So like, for example, Fraser Lake is one community that I work with every Monday. And so initially it was interesting because we had this beautiful clinic that they could go into, and the conference was set up for them. So it was all being covered for them already through their own health insurance. So we had a nice big room, good setup, easy to ask people to move around, safety in place. And recently we've been moving more completely into their homes. So people have been using, and this is where some of the challenges come from. So there they don't have good internet service and it can be spotty. And a lot of them don't have computers, and some people don't have internet. So they've been using their tablets or their phones a lot of times. And I guess a challenge from that we found is getting people sometimes into the right position so you can see their whole body for the movement, learning how to coach them into getting it into the right position. So those things, I think, have been something we've been learning a little bit along the way as well. We ran into some, I guess, technical issues with just even talking back and forth with people and the slow internet. So this morning I saw somebody, and because of the slow speech, we could see the video but not the speech. We just use speakerphone. I just use my cell phone, put it on speaker. So there's easy fixes like that we can do as well. I've had another lady she was 84, and she's hard of hearing. So her son was the translator for her. So I was coaching her son to what to tell her, and then also asking her son to help out with different movements that that person would have to do for their treatment and for their rehab. So, I mean, those are some, I guess, challenges and things we've been working with. It's been a great community to work with for sure, but if anyone has questions about anything else, then we could, they can ask and I can try to answer.
Thanks, Nancy. Can I just jump in quickly here? You rose a really, really good point on having a person in home. So whenever we have clients that are a bit more mobility impaired or balance impaired, especially for safety, we always ask them to have someone in their house or present during the session in case of emergency. So yeah, good.
Can I ask a question, Nancy? Thanks for that. I'm just thinking, so these would be, you know, the patient you're talking about, just sort of community dwelling, just patient who's out there. And I see that Krista Wark is on here, you know, who leads the Global Physio podcast. It'd be really amazing if somehow, and I don't mean you, and maybe it's the collective of us, but wouldn't it be amazing to sort of hear the voices of patients in Tele-Rehab and how they experience it and how they see challenges, and that can be fed back into like a quality improvement cycle almost. So yeah, I don't know.
Give me 6 more months.
Oh, is that your thesis? Oh, sorry.
Yeah.
I was going to mention too, we have, so while they were going in clinic in the hospitals, we have been doing post-assessment surveys with the clients that they fill out, so that, because we wanted the feedback as well, because we're just trying to improve how we're delivering the service as well. So that might be interesting to get in touch with you, Jen, about. I can talk to, there's 3 other physios that I'm working with, so it's divided, we're kind of spread out throughout BC. And we kind of found each other and are working together from different places in BC. So I can chat with them about it, and maybe we can get in contact about how that's going. Because I think we were talking about it as well, that that's kind of good as a whole, so we can see okay, well, where are we lacking with this service? What are we doing good at? And then kind of where we can improve. And I saw a question about how you use phone only without a video. So I have right now for 2 clients, they don't have internet. So Fraser Lake is allowing them to use the clinic on a need-only basis due to COVID. But we can't see them consistently. So I do, no matter who it is, we've been doing 1-week follow-ups unless it's absolutely needed before. We use PhysiTrack just because the messaging app is so simple. So someone can simply message us and we can get it kind of right away, get back to them that night or as soon as we can. For my 2 clients that don't have internet, they have my phone number and my cell. So I've just made a boundary of, okay, you know, call me after this time in the evening is the best. You can leave a message. I'll get back to you as soon as I can. Especially for the more elderly lady who's post-fracture and is hearing impaired. So they do just have my cell phone number. And I have followed up with them kind of as needed to chat about their exercises or any other question they have. But at the end of every meeting, we do plan a phone call follow-up or a message follow-up. And then there's a plan for another video meeting when we need it as well.
I think what we need to also think about as a whole is why we're using this service as physios. So are we using it as a education tool? Are we using it as a consultation tool? Or are we actually doing a full assessment, full intervention? And obviously for full assessment, full intervention, we can't really use a phone, like just an audio phone, because we can't see our clients. And that's where it comes with better understanding what Tele-Rehab as a whole is, because there's different ways you could do stuff asynchronously. So for example, using a activity tracking device to supervise them remotely. But most of the stuff we're doing right now with COVID is a lot of the synchronous methods. So looking at the video conferencing where we can actually see and reassess our clients.
Nice. Yeah, so I think we have, Mike mentioned we have Krista in here too. I think she's got a lot of experience because she actually set up a Tele-Rehab business pre-pandemic. We're going to start talking about things pre-pandemic. And Krista was ahead of the curve on it. So I think she has some good experiences to share too.
Yeah, hey, thanks, Bill. So I launched my telehealth business like 1 week pre-pandemic. So very close to, but right before. I just wanted to chime in about clients' experiences so far. So I also work in a clinic and I treat a lot of pelvic health clients, a lot of expecting moms, and so much is changing for them right now. So I've had 4 really successful sessions with expecting moms who are due in the next month. And I would just say that the feedback I received from them was really positive, and they found it incredibly valuable to go through all the kind of pre-delivery education I would normally go through. So I didn't really feel like my potential treatment was hindered at all because most of what I would do is education at that point anyway. So really, really positive feedback because they're feeling so isolated and anxious right now. So that was really great. And then in terms of the rates, what I've heard, so I've talked to a lot of different people implementing telehealth, and most people are trying to keep rates the same as what you would do in an ortho clinic. Some of my colleagues have said they'd like to lower the rates just a little bit, but for the most part, people are saying, let's try to keep our rates the same. I will say that I typically spend an extra 20 minutes on 30 minutes of my own time building exercise programs for people. So it's not just the time I'm with them on the video call.
Great. Thanks, Krista. Thanks for chiming in. And I saw, so Ala was saying that her clinic offers 15-minute free consultations, but then regular fees for assessments and treatments, and she's in Toronto. So that's kind of another example and something that I think a lot of people are trying to figure out right now. So that's great to have experience and experienced people in here. So we'll kind of, unless there's any other kind of pressing comments or questions, we'll wrap it up now. We'll kind of leave it open for people to, you can stay and continue the discussions, but we'll try to keep these sessions pretty short. And just a reminder that the next one will be on Thursday with Sandy Brennan, and she's going to be talking about acute care and emergency care. And I would like to thank Jen for coming in and speaking with us with all of your amazing experience. And I'm sure a lot of people will be reaching out to you in the next few weeks or so. And for everyone for chiming in and keeping the discussion going. Mike, I think you're up.
Well, I was just giving the thumbs up for Jen, and I'm sure she's happy to answer more questions. But Stefan or Stephen, I'm not sure if you're francophone or not. But so Stefan, are you still there? And is this like the first time this has happened in your small ortho clinic where somebody said, "Listen, can we do a video consult?" Because I think what Stefan is talking about here is like exactly what most clinics around the country are experiencing right now. And I'm not speaking for you, Stefan, but I'm just saying you've had a business, things are changing, you want to provide care, maybe it hasn't been part of your portfolio from before. So how do you leverage in, and who do you reach out to? How do you do it? So Stefan, do you mind sharing some of your experience?
Hello.
Hi, Stefan. You're good. Go. Yep. Welcome.
Yeah. So, like I said, 10 minutes before this, someone called in requesting a phone consult. So I quickly called her back and say, I'm going to be busy for the next hour or so, but I can call you back. But yeah, this is the first time ever. We've never done this. I operate a very small clinic, which is actually attached to my house. And, so I need to figure out like how I do that. I saw a great comment from, I believe, is it Jen? About, privacy. So I need some advice on that. I mean, the simplest way for me to do it, and now I recognize that, FaceTime and such are probably not the way to go. But so any sort of advice, I want to help people out. Otherwise, obviously, I'm shut down for who knows 2 to 3 months. I don't expect this to be, a big revenue generating, but I certainly want to keep communication with my patients and give them a hand.
Stefan, I'll leave my email there for you, and we can definitely send some questions over, and I can help you out.
Okay, that would be great. Thanks for that.
Hey, Stefan, while we have you, can we maybe ask you, like, how are you feeling as a small entrepreneur out there in terms of where this is going? Maybe if you hire staff, just maybe give us some of your experience now, brother. I'm thinking this is not good.
Yeah, no, this is definitely not good. I run a pretty tight ship in the sense that I have a subcontractor who does part-time work about 20 hours a week. I do about 30 hours a week. The place is small, or I should say big enough or small enough for only one physio at a time to work. There's 2 beds. And, so at the end of this week, I've been closed since last Tuesday. At the end of this week, I will lay off my receptionist slash part-time, physio assistant. And the contractor is obviously without work. She is 6 months pregnant. Her husband works for Transat, so he's losing his job. So there's this is a big burden. And for myself, well, the place is shut down. I shut it down as quickly as indicated, and I'm bracing for 2 to 3 months, to be honest with you, because I think even when the public health authorities are going to start really relaxing the containment, I think patients are going to be very, very hesitant, with the exception of a few who are probably not being very responsible right now. Well, they will be the ones that are going to be the quickest to seek help. But otherwise, I think it's going to be a very, very slow pickup.
Well, yeah, thanks for sharing that.
You're welcome.
That probably a lot of PTs just like you in that scenario, right? It's
Yeah, yes, a
well,
lot.
that's the only if I can, not that I have advice, but what we're hoping this structure is a means of communication, a means of staying in contact, a means of thinking broadly. I mean, if hopefully you'll have a chance to join on Thursday, and then you'll hear from Sandy Brennan, who's going to talk a little bit about sort of how her clinics, like a very small clinic in Canada, has been able to retool itself into being a use to the local hospital. But I feel for you, man.
Thanks a lot. Thanks a lot. We'll get through it. It's just a tough time. That's all.
Yeah, it's definitely definitely feeling for you, Stefan. I know there's the clinic that I'm working for here is also having some similar challenges in that. So it's it's tough times for physios, especially because a lot of what we do is so close contact and with our hands. So yeah. Now, any other questions or comments? I know Jen has offered that she's willing to do another session too if people have questions for her. That for people that are specifically looking at Tele-Rehab and looking more specifically on how you can implement that and overcome some of these challenges. But we'll open it up again to anyone here on the floor or in your bedrooms at home. You can ask a question, and if not, we'll talk about maybe having another session with Jen too.
Can I jump in really quick, Phil?
Yeah, absolutely.
Okay, there we go.
Yeah.
Video's on. Yeah, I just wanted to thank you, Mike, for including those details about the Parliament's discussion about the bill that's being held up by that single MP. For my own situation as a non-clinical physio who is more of a social scientist than a health profession these days, I'm trying to figure out how my contributions are best made as part of this pandemic crisis. And I'll likely be watching the political dynamics and seeing at which points my voice is helpful as a member of a health profession, as a university employee, and so forth, because I think we'll see a dynamic where there are certain players who try to use this crisis as an opportunity to grab power. And in other cases, as it appears with this bill, that people might hold up things that are essential for silly reasons that delay it and cause us all grief that lasts a long period of time. So thanks for that update. I do plan to keep attending these meetings as I determine what my activities are, and I found that really useful.
That's amazing. Thanks, Sean. And I know a lot of you know Sean, and he's one of the, he's an expert in global health, and I'm going to extend an invite to have you talk at one of these sessions because we would love to get your perspective on what's happening.
In the acute phase, I suspect that there are a dozen people on this call who are more useful than me, but at some point, yes, I'm willing and I look forward to it when the time comes.
Incredible. Thank you.
Well, and let me jump in, and I totally agree with what Phil said. We've got here a cast of folks around the virtual table with amazing experience. But for sure, Phil will agree. But now we have to start thinking long term, and in a future, it's not a zero-sum game. It's not as though we can only focus on the acute, and then when it's more convenient, focus on sort of long term. But just put this in the your mind in terms of consideration. But Right now, we have a lot of folks in across North America and the world, but let's just talk North America, who are probably fairly high risk in terms of cardiovascular disease to begin with. And now we're isolating them and we're restricting their movement. So we generally see this bimodal distribution in an emergency where you have the acute phase and then a lag time and then a rebound. And so we are likely to face a whole whack of real surges in terms of disability related outcomes. And so now now is the time to be thinking this. It's not easy. I'll be quite honest. I'm not sure even through the associations, the regulatory colleges, like, where are we? You know, what are we doing? Like, how do we get there? And how do we think about the practice of physiotherapy? So Phil, I think we should definitely have Sean come in and give his perspective as to where this all goes after we're done. So thanks for that, Sean. I really appreciate it.
Okay, so if there's nothing else, no other questions or comments, if you're interested, then we can, we'll see if we can get Jen back in to have a chat. And a few things that came up today from this discussion is just that we have a lot of experts around this table in terms of the challenges that people are facing in Canada and in terms of rehab and physiotherapy. So really trying to make an opportunity and create an opportunity for people to reach out to these experts that we have within the country. And thinking about the role kind of in all those stages of the disaster that we were talking about last time, but also kind of the broader role that physiotherapists play. So even in terms of, one of the things that came up in Tele-Rehab is that some people may not have access to, say, internet or be using like computers and all that as much. And just thinking about also some of the barriers that people would face. And in situations like a pandemic, some of the stigma that might be experienced by certain groups, like people with disabilities and older people, and the huge role that physiotherapists and rehab professionals can have with that too. So we'll try to include that. And if you have any comments or people that you think should be coming in to provide their perspective and experiences, then please let myself or Mike know, and we'll do our best to get them in and keep the conversation going. We'll wrap it up. And any last words, Mike or Jen? No, got the thumbs up from Mike.
Thank you, Jen.
Yes, and thank you so much, Jen.
Thanks, guys.
You've been working on this for a long time, so we're very grateful to have you here. And thanks everyone for being here. Again, if you want to be part of that listserv, so it's rehabcovid19@gmail.com, and all the information from the last session and this session will be on phil-sheppard.com. And then once we get the other website up and running, we'll switch it over so it's not just my name you have to type in every time. Okay, thanks again. Yeah, have a good day, everyone.